Hi, this is Dr. Acker. Welcome to Nurse 220 and 220L, Spring 2015. I am so excited that you decided to spend the next 7 weeks with me as we journey through health assessment and health promotion for the nurse. I wanted to make this video for you to give you some clear course expectations and maybe some tools to help you be successful within the courses. The first thing I wanted to start out by telling you is that I promise that yes, I am a real person. I'd like to introduce you to myself and my husband, Chuck. Chuck is the most fabulous man ever. We are newlyweds. We just got married last year, so we are still in that bliss. He is originally from Denver. He is self employed and currently contracts with a company called Friends First out of Denver that is a nonprofit in which he goes into junior highs throughout Colorado and speaks. He talks about healthy choices, how you're going to go to college, how to leave a good legacy, and things like that to help our younger generation um, do well. Myself, I became a nurse, RN, I should say, in 1999. I began my career in the CVICU. I have worked in the CCU, cath lab, pediatrics, and oncology all over my lifetime. I actually just stopped working in the cardiac ICU about a year ago as a nurse. Even though I was a nurse practitioner, I loved bedside nursing, so I did both and finally decided that my plate was full and I needed to give something up. So I am no longer bedside in that manner. In 2007, I decided to obtain my master's degree from the University of Kansas. I am a diehard rock chalker, especially with March Madness going. We're still in it. I also, in 2007, obtained my certified nurse midwife degree as well. In 2012, I decided to go back to the University of Colorado Springs, to obtain my doctorate of nursing practice. And I currently am still a student. I just can't seem to stay away. I love education. So I'm currently at the University of Colorado Springs, in which I am finishing my family nurse practitioner. I have 2 courses left in that. So as a student, I understand the importance of a well-organized course, clear expectations, and I am not a fan of doing a lot of extra work that doesn't seem to correlate to my degree, my education, or how I'm going to be able to apply it in life. So I try really hard to condense my courses down to give you exactly what you need so that your time, as I know is very valuable, can be spent working on things that are really important. Chuck and I do have 4 wonderful children between the two of us. We are so excited to have a 19-year-old, 17-year-old, 11-year-old, and a 6-year-old. Um, I do teach at University of Mesa, or Colorado Mesa University. We just changed our name not so long ago. And I teach there full time in the doctoral nursing program. I actually teach across the nursing program, so I do undergrad, graduate as well. I do work in Montrose as a nurse practitioner, certified nurse midwife, full time as well. And I'm a student with a family, so I feel your pain and I know how busy you are. And let me tell you, these 7 weeks are jam packed, but we are going to get through this together and it should be a great course. I'm really looking forward to it. So let's get started with the course expectations. I wanted to start with Nurse 220L, the lab, because there are a few students that decided to take the courses separately, and so they have already had 220, and they are just here to join us for 220L, and I did not want them to have to sit through the longer video for 220. So starting with 220L, this is a really cool course. We started it last semester doing clinical virtually because a lot of you are struggling to find clinical placements. We weren't sure what was being taught in clinical because your clinical placement is only as good as the experience or the preceptor you have. So this is a way to bring together everybody so we know what's being taught, to know when you leave this that you were taught X, Y, and Z the same way as everyone else. So the expectations as you move forward will be equal playing field for everyone. So, your virtual clinical will be done in a program called Shadow Health. This program can be accessed from any computer, anytime, as long as you have internet access. It is not connected to CMU, so if the server at CMU is down, you can still access Shadow Health through any internet source. You will need to buy a key if you've not already done so. I sent out an email last week explaining how to do that. It's also within your syllabus. And once you log in, we have 7 weeks worth of fun. Everything in this course will be done in Shadow Health. 100% of your work is done there. The only thing that you will find in D2L for this course are your grades, as we couldn't merge the programs because it's not a CMU program. So you will be going there to get your grade. With that, let me give you a caveat. When I grade your information or I give you feedback, um, on what you're doing in Shadow Health, you will get emails directly from Shadow Health with that feedback as that system then shoots it to you. What you will see in D2L is a number grade based off of a rubric, and you can find those rubrics in D2L under important course information. And the rubric is pretty clear cut and dry. You either did or you didn't. And I click it, you get your points, and that's how you get your grade there. The rubric will be dropped in to the grade book for you. What you will see is your grade. There will be a comment box. Make sure you click it, and then that will open, and you'll click a little link that's in there that takes you to your personal rubric. Okay. If you got all of the points, 100% of the points on the rubric, you will not get a rubric. Okay. If you got 100%, you did everything right. Therefore, you don't really need a rubric to see what you did or didn't do. You will only see a rubric there if I took off points for some reason. Okay. So you get one shot at it um, of each module. And I'm going to give you some pointers on how to successfully complete modules. I would also let you know that this is your clinical, and a lot of people last semester felt that the clinical and the didactic course was a lot of work for 3 hours. But you have to remember, this is really a full 16-week course that's condensed down to 7 weeks for you. So your expectations are that you complete a full semester of work in 7 weeks. So it is a lot of work. It is not your typical 3 hour, what you're used to of a 3 hour course. You do have to do 3 times the amount of work as you're getting it, done much quicker. So you will do a full semester clinical here. I recommend to everybody that you allot 1 day a week at least for your clinical experience, just as though you were going to regular clinical. If you were at a regular clinical, you would have to have time spent going to get your assignment, getting prepared, looking up your drugs, getting a care plan together, so you had all that prep time, and then you actually go to clinical for those 8 hours or however many hours you're there. Same concept here. It may seem longer because you're sitting at the computer the whole time, which can just drag out throughout the day, but I strongly recommend you do each module in one setting. A lot of feedback I got last semester is that it was really hard to start your clinical or your module and then walk away and come back and figure out where you picked up because you kind of lost your um, uh, just like I just lost. I lost my thought process, and so really schedule it as 1 day. I also recommend you don't do it in your home if you have other distractions. It's really hard to stay focused when laundry's calling you, the dishes are dirty, or you may have a child at home. I recommend going to a library or somewhere that you know you're going to be able to focus just on clinical. So looking, other tips is that make sure that you click on every button. Make sure you're clicking on all the help screens that they give you, okay? It may seem redundant, it may seem really time consuming, like, I already know what the safety features are, but if they ask you, do you want to review the safety features for your patient, say yes to make sure that you get every single one of them. Another really good way to get through this and know that you're asking most of the right questions is make sure you're using your Jarvis book that you use in 220. And I will tell you that the Jarvis book that we are still using for this section of the course is the 6th edition. I do realize that the 7th edition just came out. However, it did not come out soon enough to make this course to get changes made. So if you bought the 7th edition, I'm really sorry. The syllabus does say the 6th edition. The 7th edition can still be used, as it simply added a chapter or two that we won't have in this course. So just try to correlate the chapters to what it is that we are doing within the modules at the time. The way that you could use your Jarvis book, it's really a roadmap to how to successfully complete the course, is, for example, if you have the 6th edition, go to chapter 21 for the abdomen. It starts on page 527. Um, if you jump over to page 532, it starts talking about subjective data. This is what you can use for shadow health, because you're going to have to approach your patient and you start a conversation with them. I will tell you, make note of this, write this down, highlight it in 3 colors. You need to start your interaction with your patient every single module the same way. While Shadow Health says that this is the same visit throughout the day, they don't really set it up that way. So I'm telling you, start over with your patient every single time. You're going to walk into the room and say, "Hi, my name is Dr. Acker. I'm going to be your nurse for the day." You can say, "Can you tell me your name?" You want to identify your patient every single time. You want to look at their bracelet, but the really highlight. The course does not require this, or the program itself does not require it, but I do. I want 2 patient identifiers every single time. So when you look at their armband, I want you to verify their name. Ask her, "What is your name? What is your birthday?" 2 patient identifiers every single time, just like you would in a hospital with a real patient. I have made that feedback to Shadow Health, and they are going to put that in the next version, which will be coming out soon, but it is not in this one. So make sure 2 patient identifiers every single time. I don't know how important I can tell you that is. So looking at page 532 under the abdomen, when after you've identified your patient, you've gone through all that stuff, talk to her like a real patient. "Hey, I'm here. I need to do a physical exam on you." And if, let's say, we're talking about the abdomen, this module, start with question number 1 under subjective. Have you had any change in appetite? Has your weight changed? And it seems like a lot to ask, but if you go through all of these questions, do you have any difficulty swallowing? Are there any foods you cannot eat? Do you have any allergies? Blah, blah, blah. Any abdominal pain? And when you talk about pain, make sure you do, when did it start? What's the onset, location, duration? What did you do? You're a nurse, you know how to do all that stuff. You actually have to ask when you have that happen. So if you run through all of that with your patient, and there are pages of it. I think it goes all the way through page 535. You ask these questions, you're going to successfully hit your tiers. So there's a tier 1 and a tier 2 in the system. Tier 1 is absolute. You have to know this information. That's what makes you safe. Tier 2 is what makes you a better nurse. There are thresholds that you need to meet. That is all explained within the course. It's shown on your rubrics. And Shadow Health will then give you a report at the end. You met 85% of your tier 1 and 25% of your tier 2s. It will then show you where you can go to see what you missed or what you didn't miss. When you do your physical examination, for example, if you look at page 536 of your textbook, moving on, you can do what's shown here for an abdominal exam. You also, within Jarvis, have been given Evolve assignments, okay? So you need to log on to Evolve, and that's explained in the syllabus. You're going to do those Evolve assignments. Before you start your module, I strongly suggest that you look at the video for each section. It is an actual video of how to do that particular health assessment. And that will also help you. So those are really the key things to understanding how to be successful in shadow health. I will tell you, make sure you read the syllabus, look at the late policy, make sure you're looking at the modules before you start, or not the modules, the rubrics before you start each module, so you know what's going to be graded, you know what's expected of you. Um, Give me 1 second. I just want to look in the syllabus here and make sure there wasn't anything else on this course I wanted to tell you. Um, Oh, there is. Okay, so within some of the modules, you're going to have a place that is called the hallway. And in this hallway, you're going to encounter other healthcare professionals that are going to ask you a question about your patient. So, what I'm really looking for here is I want to know your knowledge. You don't necessarily need to look it up, and you don't need to necessarily cite APA unless you just absolutely did it. As a nurse, I know you guys have knowledge, you know what you're doing. I want to hear what you would have to say to me. You know, if I ask, hey, how is Tina's gait today? Is she safe? You know, what two interventions can you do to keep her safe? You already know interventions to help keep somebody safe. You know, call me before you get out of bed, and this is why. I also ask you, um, how do you know that your interventions worked? So, whatever I ask, make sure that you look at the question and you answer the question in full, or you will not get points for it. Um, I really kind of think that's it. It's kind of there's a learning curve. So, you know, if you get a low score on the first or second module, do not panic. Just go back to the basics. Use your book. Go to Evolve. Look at the feedback. There's usually, last semester there was a 4-week learning curve. I'm hoping that that's reduced by having this video and being able to have your assignments open earlier. Um, so hopefully by 2 weeks, and you guys are going to have this system down, and it's just going to be awesome. So that's really what I wanted to tell you about 220L. Feel free at any time to shoot me an email. I'm pretty much, I respond pretty quickly to emails, phone calls. Don't leave, if you leave a message, no, email me to let me know you left a message. I don't always get to my phone as quick as I do my email. So anyway, let's move on. Nurse 220. So this is the didactic course for those that have signed up for that. Oh, I did want to mention that these courses, while they go together, 220, 220L, they can be taken separately. So if you feel like this is too much work or you're going to be overloaded, you know, feel free to drop the lab portion. You do need to take the didactic before you take the lab, but know that you need to drop that to get all your money back before classes start on Monday. But just know that they can be taken separately. I will be teaching it again over the summer. So, how to be successful in 220. There are a couple ways or a couple things we're going to talk about. We're going to go over the syllabus, the calendar, your quizzes, and your discussions. So I would encourage you right now to please have your syllabus printed and ready to go. So when we talk about the syllabus, let me see where I am in my presentation here. Yep. When we talk about the syllabus, this is our contract. This is your and my agreement on what to expect in the course, when things are going to be due. This is where you should go if you have any questions prior to asking me. Okay, I do get a lot of questions that come straight out of the syllabus, and if you do that, I may send you back a response that says, look on page 12 of your syllabus. Okay, so just start there first. I will tell you that I have a professor at UCCS. I have not implemented this yet in my courses, but she'll deduct 5 points from your grade should you ask an actual question that is found within the syllabus, which I think is sort of a great idea. Just because we get so many questions that are just basic questions. I don't mean if you have a question about an assignment, if you need clarification, that's fine. But if it's just, for example, you want to know, hey, how many quizzes are there in this class? Well, you know, on page 7 of your syllabus, it shows you there's 20. So let's get started talking about the syllabus. There are some areas in the syllabus that I definitely want to point out. I strongly encourage you to read it front to back, as your very first quiz in this class is actually over the syllabus. You will need to pass the syllabus quiz 100% before I will allow you to earn any other grades within the course. That doesn't mean you can't continue moving through the course. It just simply means I will not give you a grade for anything you've done until you have completed the quiz at 100%. So let's look on page 7 of your syllabus. There you're going to find a breakdown of where your points come from. This is a weighted class, and so everything is worth a different amount towards your final grade. As you can see, your final exam is 100 points, and it is 30% of your grade. Most important part of your grade comes from that. Um, if you look at the very back of your syllabus, um, it has a course schedule. This is what I would print off separately from your syllabus. Um, and I would, let me see if that's my next spot that I'm going to. Yes, talk about the calendar. Now, organization is going to be key in this course because it's going to be so busy that I'm going to tell you right now, go grab a calendar. I don't care what it is, how you do it, enter all the course dates that are due now. Within the course schedule, you're going to find everything you need to know for this course, when it's due, what's open, what your reading assignments are, okay? And what I did here is I gave you right here, an example of the calendar I actually use as a student and to work. I don't know if you're going to be able to see my cursor. I'm hoping that you'll be able to see that on the screen, but at the top along here are the days, and it's a 2-page. It unfolds flat, so if we were to keep going, you'd have Thursday through Sunday on the other side. And then down here, these sections are actually a section. This is a family calendar, and it's actually like meant for every person of the family. So right here, I actually have my name, and this is my work schedule. So I have that there. The next line I use for my family. If anything's going on in their lives that I need to know about, I put it there. And then I have my UCCS course, because I'm a student, what's due there. And then these down here are the courses I actually teach at CMU. And I will put in, this is what's due. This way, you're able to see your work schedule, your family schedule, your school schedule, all your assignments in one foul swoop. Now, this can be done digitally, like, for example, with Google Calendar, because you can color code everything. So, however you do it, just make sure you get it all down in one place that you can see so that you know, looking, oh, wow, I work Monday and Tuesday, but yet I have a paper that's due on Friday. Do I have time to get it done? So, that is probably one of the things I can tell you be most successful. In my course, everything is always due at 1800 Mountain Standard Time. All the discussions open and close on the same days. All the quizzes open and close on the same days, with the exception of the last week of class because it ends on a Friday and not a Saturday. So there's no confusion that this week the quiz was due Wednesday and next week it's due Saturday. It's all due the same time. It's consistent throughout the course. Um, Let us move forward. Quizzes. So the quizzes within this course are really meant to be learning quizzes. There's no way to cheat on them, okay? I would like you to try to do them individually if you can. You are allowed to retake the quizzes. So my suggestion to you, use the quiz as a study guide. Take the quiz as soon as it opens. Your modules open the Saturday before the module starts, with the exception of the first week, obviously. So class starts on Monday, okay? Week 2, well, okay, the next week is actually spring break, but week 2 will open that Saturday night at midnight. So you have all day Saturday, all day Sunday to get ready for the next week's stuff. The quiz opens Monday at 1800. I would log on Monday night, even if you haven't looked at anything, blindly take the quiz, okay? That gives you access to the questions and the answers, the answer selection, your answer choices. Then, as you're studying throughout the week, you know what I'm asking you on the quiz, you know what the answers could be. That way you can look up your questions, find the answers, and retake the quiz to get the most points. They're meant to be learning quizzes. Discussion board. Your discussion board is going to be really important this semester, okay? For more than one reason. You will find that discussion is where you guys do most of your learning within the course. This is health assessment. The book does a really good job laying it out. Therefore, you're not going to have lectures from me because it's redundant. The book offers Evolve resources that I have assigned. There's videos that you can look at that are going to teach you how to do a health assessment for each part of the body. There's going to be all sorts of resources for you that are already developed. So there's really no reason to add to your time by doing lectures over the exact same thing that they've already done. So in this course, you will not have additional lectures, okay? It's all laid out here for you to do. So discussion board. Let's go and look, find the rubric in your syllabus, okay? The rubric, I'm not going to give you a page number because mine printed out different than yours. I'm certain of it, but it'll be under discussion. It says CMU, RN to BSN discussion board and class participation. I wanted to go over the sections with you so that you know how you can get full points, okay? So when you're in school and we give you a rubric, the first line, if you want 5 points for each section or 25 points total, that is an A. An A is exceptional work, above and beyond the minimum requirements, okay? The next line, all fours, that is actually your minimum requirement. That will get you a B and that will get you passing the grade. However, I will tell you, discussion is almost like free points. If you do what's on the rubric, you're guaranteed the points. Therefore, it buys you a little comfort room when you're taking your final exam, okay? So if you want all 5 points, you're going to go above and beyond. For example, if you look under frequency, if you look at the 4-point range, it says participates frequently 3 times a week. If you want an A, participate 4. That's exceptional. 3 is what's expected. If you want 5 points, be exceptional. Okay, use references. Now let me just go over what references are, okay? If you use Wikipedia, that is an automatic 0. 0. Wikipedia is not a scholarly reference, as anybody can log on and change the content. What I want you guys to be doing, if you have to get a reference for anything, which you know you will as we go into discussion board, I want you to go to journal articles. Okay, you can get through this through the school library. Even if you are a distant student, you do not need to be on campus. You just need a MAV card. If you need help doing this from home, contact the librarian. She's awesome and she will help you and show you how to get to journals. Okay. You want to minimize any kind of website usage. So if you're doing like Mayo, make sure it's not the patient education website because that's for lay people. This is a scholarly course, therefore you need to use scholarly work. You need to use references within the last 5 years, as that's scholarly. Um, and you need to be able to cite it and reference it appropriately in APA format. So make sure you have your APA book with you. Um, Talking about plagiarism, huge, 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 and you can be and may be dismissed from the program should you plagiarize. And let me tell you, plagiarism is not based on intent. Even if you don't mean to do it and you do it, you will still be held accountable for it in this course, okay? I know each course is different, but I'm telling you up front, plagiarism in my course is not acceptable practice. So when I talk about plagiarism, think about this. If it is a concept that you yourself did not create, you need to go find a reference for it and reference it. If there is a period and you start the next sentence, but you're going to use the same reference, that's cool, but you have to reference the next sentence as well. So you may have the same reference for 4 sentences in a row, but you need to make sure you put it there. If you have a sentence and a period with no reference, it's assumed that's your work. So for example, somebody with chest pain, if you write a paper to me and say, somebody with chest pain is going to have sternal pain that may radiate, to the left shoulder and jaw. While we all can recite this because it's been drilled to us and we now have it as knowledge in our brain, we didn't just go look it up. That is not knowledge we created. Therefore, it is so easy to find a reference. Go to Google, go to a site, go somewhere, go to a journal and say, type in symptoms of chest pain. You're going to get 1,001 hits. Pick one of them, cite it. Okay? The only thing that you do not need a reference for is things that you actually create, such as if you're talking about Ebola, let's say, you can come up with a sentence that says something like, Ebola is this pandemic in other countries that we really believe the United States got excited about last year when really more people die from the flu, blah, 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 blah. This is all just you talking. This is your information that you are now creating, okay? So then you own that. The other thing that you need to know about discussion is that you need to respond to your peers. At least 2 for minimum, 3 if you want an A, times a week. When you respond to your peers, I want you to go get an APA scholarly reference that is going to back what you're saying. So instead of just saying, hey, I agree with you, like we're going to start talking about theories in discussion. If you say, hey, I think the change theory is really a good one, and I think you did a great job, well, then I want you to go find a new piece of knowledge that we haven't brought into the course and say, so and so said the change theory is good because it allows people to change on their own terms, whatever it is. I'm just making that up. So you need to respond on different days. The discussion board is called discussion because I want you to discuss. It's not posting board, it's not blogging board, it's not information board, it's discussion. I want you guys to log on and discuss with each other. So, a really good way to deal with discussion. Discussion questions will be available to you on the Saturday before the week starts. So Saturday at midnight, there they are. Let's say you work all weekend. Let's say you don't. You got to find your own rhythm. But my intent is that you have that available to you. So on Saturday, if you can, look at that question. Start devising your answer in a Word document. Make it a lengthy one. Really spend some time on it. Do the same thing on Sunday if you need to keep following it up. Then on Monday, you need to cut and paste and post it. That's all you have to do. That's your initial discussion. And boy, you already have it done. Then on Tuesday, if you if it's a really long one and that you can piece it together, cut and paste a little bit more of that and put it in on Tuesday. You now have two. Now you just have to respond to your peers. So on Tuesday, pick one person, look at what they're saying, look something up about it, post to it really quick. Same thing for Wednesday and Thursday. Then you're done. You're done You're done by Thursday. Friday you're off, free day. Saturday we do it all over again. So you just got to find your way and figure out what's going to be best to help you get this done. Now, what I did do this semester, which I'm hoping is really going to help, is that I changed our whole discussion topic and what we're going to do. So discussion is going to tie and coincides directly with your health promotion topic that you're going to do. So this health promotion topic is really meant to be um, a project that you're going to write a paper about and you're going to do a PowerPoint about, okay? And I gave examples of both of those within the course. I suggest that you print out that paper so you have it to look at, okay? Um, there is a rubric for it, and the rubric is going to be your headers of the paper, okay? For example, if you look under in your syllabus, mine is on page 11, so yours may be page 11 or 12. It says health promotion paper. Okay, let's talk about this in depth. The paper is going to be a maximum of 6 pages for the body. That does not include your title page. That does not include your references. Just the body, maximum 6 pages. I will stop reading after 6 pages, okay, which means you will not get a grade for anything past that. And again, that is the body of your paper. Um, if you look at towards the bottom, it says what I would like to see in your paper. I'd like to see a title page with a running head. There's an example of that in the paper I put online. An abstract, again, there is an example. Introduction. Um, so introduction does not have a header, but once you get to background and significance, you are going to make a header on your piece of paper so I know that that is your background and significance section. You are also going to do one for patient benefits, health promotion framework, nursing diagnosis. These are all of what you're being graded on, and they are all in your syllabus, okay? So what I did is I broke up our discussion questions to really go over these areas of your paper. So as hopefully the first week, I can get you to narrow down your project to what you guys want to talk about, okay? Once that's approved, everything in discussion, I want you to base it on your project because I want you to build your paper as we're doing the discussion. Don't wait till the last minute. It's going to be really hard to do. If you practice this, if you go through discussion, answer all the questions and really participate, you're going to have that section of your paper pretty much written to be able to cut and paste, put it in your paper, and then just format it. It should flow like that. So, for example, we're going to talk about health promotion framework in one of the weeks. So I'm going to give you some theories. We're going to talk about them, and then I want you to pick one for your paper. That would be a great time that weekend to write that section of your paper. if that makes sense. So by the time we're done with discussion, hopefully your paper's ready to go. Other than a little formatting and some tweaking, um, it's all good to go. So one thing I will tell you about your paper, do not write it in first person. Okay, we do not want to use I think, I believe. It's not about an I. You need to learn to write scholarly and professionally. So no first person in your paper. Okay, so that's kind of how discussion board correlates with the health promotion project. And I will start off the discussion each week, and I participate within discussion with you. So I will be present and I will be asking you questions. So remember, try to get your topic in first week so I can get it approved, so that as we're working um, in discussion, you're able to talk about your project, and that way we're ready to go. Um, let's see what's next. Oh, well, looky there. I just talked about it, I didn't show you my slide. So health promotion project, let's make sure we did it all right. So we talked about the syllabus, looking at what's expected, your topic, that's in your syllabus. You're going to provide me with a one-page document in a Dropbox, or you're going to talk about a health promotion topic. Now, as you're picking your topic, we're not going to do simple things like hand washing. We are hopefully not going to do just that basic sort of thing. I want you to pick a topic that you could use at work that will enhance the patient population's overall health. So if there's something that you have to teach a patient on, for example, let's say, I don't know, let's say you have a patient that keeps coming back to you and never takes their pills. So you want to say, hey, there's this great app online I want you to use to learn to take your pills. And then you can do a whole project on how to implement that. So, try to pick a topic that you're having to do a lot of talking about, that your place of employment could actually use on your unit to educate your patients. Do not make it broad, so don't say medication side effects. That is way too broad because you don't know what meds they're on. But if you want to talk about how to properly take a Lovenox injection, that's pretty straightforward and simple. Don't use that one because I just gave it to you. So come up with something that you guys could really use. We're going to do the paper, we're going to do the PowerPoint. So let's talk about the PowerPoint. I'm just going to go ahead and make sure I don't have a slide for that. Nope. All right, let's go back. All right, PowerPoint. So as we look in syllabus as well, there is a section on the PowerPoint. Here's some tips. It says in here, each slide should only have a maximum of 3 bullet points. Okay, so if you look at most of my slides, I have 3, max 4 of just these simple, let me put them back up here for you, bullet points. It's the basic topic of what you're going to talk about. It's not written in sentence form. Do not write your PowerPoint in a sentence form. Nobody wants to watch a PowerPoint that you're reading verbatim to them. So the idea is you make these basic slides. You are going to put the basic topics. So I put syllabus, topic approval, paper, PowerPoint, and then I'm expanding on each one of those because your PowerPoint is going to be a voiceover PowerPoint. There are tutorials on how to do that within PowerPoint. You are free to use other things such as Camtasia. I've had people use their iPhones to record somehow and put it up. I will tell you that oftentimes your presentations, such as this one, is way too long for D2L to be able to hold. So I would suggest that you guys make a YouTube page and then you can upload your video to your YouTube page. It will then provide you a link that you can then put into the course for people to link to your video. If you don't know how to do that, you can Google YouTube, how to make a video for YouTube, how to link a video. It's all online for you guys. When we talk about your health promotion topic, the slides here are the titles I'd like you to use. You may vary from them just a little bit if it fits your program better. but I need to know that this is what you're talking about. So, you could say, why is this important versus why is this important to me, if that's easier for you. It needs to be no more than 15 minutes, and it definitely just right around 15 minutes. So try to stretch it out. You don't want a 5-minute video that will not award you full points. So anyway, the rubric is there. It kind of tells you how to do it. And basically, you're going to make your PowerPoint presentation. I would recommend doing it as you go. So actually, I lie. I take that back. I would make your PowerPoint after your paper is written because you are going to take the information from your paper and put it in your PowerPoint. I do not want new information in the PowerPoint that's not in the paper, and vice versa. So they need to reflect each other, okay? Just because you don't write about it, this is not the time to do a video about it. So make sure that your health promotion PowerPoint reflects your paper. And I think that's it on that. So if you have questions, if you have concerns, if you have needs, please let me know ahead of time. I would also, I'm just double checking here. Give me one second. Um, in this course, it's different than from um, a 220L that there are no late assignments that are accepted. If your paper is late, it will not be accepted. If your PowerPoint is late, it will not be accepted. A late is a 0 in this course. There's no way for me to keep track of who's late, who's not late, and it's really personal adult learning and responsibility on your part to get it all done. So I will tell you though, I am easily accessible. If you work nights, I have no problem meeting with you at night as I have really weird hours. You will find I do a lot of my work in the middle of the night, so don't be surprised when you're getting postings and emails from me at that hour. But if you ever just want to chat, I'm also available by appointment. I would ask that you not call me, text me, unless it is a dire emergency. In these two courses, there aren't any emergencies I can actually think of. Um, that would affect your course because we don't allow late assignments in this for any reason. Um, I will tell you that incomplete grades are not very often awarded. Usually it's only for a medical reason that we would award that. If you're too busy, overworked, can't do it, that doesn't award you an incomplete, that will award you a poor grade. So really this course is doable. It's just a matter of you got to stay organized, you got to stay on time. I am happy to go above and beyond to help you in any way I can. You just got to let me know that you have a need or a question. No question is insignificant. If you have it, please, please, please ask me. I am happy to help you. Um, so with that, I want to end my presentation and say thanks for listening. I'm looking forward to the next 7 weeks.